Excellencies, ladies and gentlemen, good morning. Greetings from Pakistan and congratulations to the organizers of Precision Public Health Asia 2018 for organizing this important conference. This is a topic which is at the cutting edge of science and medicine. Precision medicine is in fact part of the many transformations that are happening in the development and health sector today. As you're aware, the Sustainable Development Goals today present a very different context compared to what was the norm in the era of the Millennium Development Goals. The focus today is very much on strengthening country institutions and systems so that the international system can focus on where it has a comparative advantage. And R&D and innovation is very much part of that new role that the international system must play to deliver on the premise of the SDGs. Ladies and gentlemen, as you know, in this new landscape, universal health coverage is the central pillar of SDG 3. And we all know that we need to think out of the box to achieve the geographic and financial access goals and quality imperatives that universal health coverage flags as a priority. Overall, I have to say unprecedented changes are happening in the health sector which hold promise of a better future for health and healthcare. To give you an example, in 2025, for example, a woman in an African village with high blood pressure and diabetes would largely manage her conditions from her smartphone, not just booking appointments and joining counseling groups, but will also be managed by AI-enabled algorithms despite workers' shortages. Her wearable sticker will interface with the Internet of Medical Things and will upload information to her electronic health records in a cloud, which can then be secure thanks to blockchain. She will be able to hire an Uber with her health savings account, order medicines through Amazon. She will be able to print pills at a local pharmacy and verify their authenticity through a text message and have her insulin delivered to her doorstep by a drone. This is not science fiction. Even today, each one of these solutions exists in isolation, and efforts are underway to knit them together by institutions that are taking over the healthcare sector. These are institutions with payment platforms and mobile wallets. They are partnering with entities that have one-click retail services, with network providers, with the insurance industry. They are drawing on big data analytics and machine learning and are disrupting and redesigning healthcare. When you view this in the overall context of changes that many developing countries are undergoing, such as jump-starting straight to 4G and 5G, a world which is on track to meet digital technology and connectivity-related SDG targets, the potential for massive quantum shift in the near future is quite evident. As co-chair of the World Health Organization's High-Level Commission on Non-Communicable Diseases, I and my fellow commissioners are looking at these new opportunities with much excitement because they can make health systems more conducive to managing and addressing NCDs with a focus on prevention, early diagnosis, and early intervention. On the other hand, as someone from the world of NCDs, I'm equally excited because of the unprecedented opportunity created by precision medicine and precision public health, which are emerging as the approaches for non-communicable disease management in the future. As the molecular underpinnings of many diseases are becoming better understood, the development of more precise diagnostic approaches and treatment tools has been enabled, as we know very well. The ability of precision medicine to subclassify populations based on their susceptibility to a disease or in their response to a treatment pathway can potentially accelerate the availability of highly targeted therapies for some of the most intractable and devastating diseases which have evaded therapy for millennia. We know that there are predispositions to diseases such as cancer, other NCDs, neurodegenerative diseases, and rare genetic conditions. These, we all know, are inherited along ethnic, racial, or familial lines. Precision medicine takes into account individual variability in genes, environment, and lifestyle. It relies on data, especially genomic data, to make decisions about specific treatment pathways. The rise in precision medicine is not a fantasy, it's not wishful thinking. Several developments are underway which signal that we are headed towards an era where it will be possible to use precision medicine as a default option. I say this because I see quantum shifts in three areas. Firstly, the success of precision medicine depends on the development of advanced diagnostic methods. And here we should note the declining cost of genome sequencing, the falling price and increasing speed of genetic testing, and the increasing availability of genetic tests that can identify key biomarkers. There have been advancements in pharmacogenetics, genetic sequencers the size of mobile phones are now in production, and point-of-care machines that can measure and give results in real time are now being commercialized even for low-resource settings. Secondly, precision medicine is depending on data. And here we should take note of other enabling factors such as the surge in health-related big data, computer science and engineering breakthroughs with lab work and clinical discovery, rise in artificial intelligence, advances in supercomputing power, proliferation in biobanking, and the list goes on. There have been exponential enhancements in big data analytics and genomics-rich clinical decision support platforms to support precision medicine research. And I'm sure you're aware that genomic analytical tools have been tested to produce treatment suggestions. The third shift is at the industrial production level. And here I'm cognizant of the expertise, systems, and supply chain mechanisms that are being developed to support flexible small volume manufacturing. Gene editing technologies and immunotherapies and other avenues of precision medicine are now commercially available. The cost of drug testing is being driven down due to artificial intelligence. So, ladies and gentlemen, the market is charging ahead to give us precision medicine as the default option. And we need to reflect on what public roles we need to play. What are the public roles in relation to precision medicine for that matter? At this intersection of science and informatics, we have to recognize that healthcare isn't just pure business. It has to be grounded in the principles and values of human rights, equity, evidence, and empathy, and that it is our role to uphold these while leveraging solutions which the market is most suited to deliver through appropriate public-private relationships. I can see many global governance imperatives emerging straight away. For example, what is the health systems and universal health coverage's involvement in furthering precision medicine? We need to set norms and standards, especially data governance standards. We need to address ethical, patient safety, regulatory and human resource capacity issues ahead of the curve, and address issues that center on cost effectiveness. The power of precision medicine lies in its promise to guide healthcare decisions towards the most effective treatment which can improve care quality, but at what cost and who will pay? What do these new therapies mean for universal health coverage packages and coverage, especially in financial access terms? Can insurance premiums cover them? So in a nutshell, ladies and gentlemen, as a clinician, I'm delighted we have new therapeutic options that are more targeted. With my hat of the WHO NCD Commission co-chair, I'm equally thrilled. With my hat of the co-chair of the National Academy of Sciences, Engineering and Medicine's new study on the quality of healthcare globally, which we released on the 28th of August this year, I'm again delighted that we have tools for quality improvement. But as someone with a deep interest in equity, I would like to see us developing the strategies and tools to overcome financial access barriers. I fundamentally believe that along with the development of these new therapeutic approaches, we need to have a discussion on fair pricing and concomitantly need to develop fund-based approaches which can additionally supplement public financing for health. This is a subject very close to my heart, and I'm also pilot testing a fund-based purchasing system in my own country, Pakistan, so that when these therapies become the default option, we are prepared with the financial tools to reap their benefits for equity. I thank you for having me with you virtually today and would like to wish you a very successful Congress.